Okay, before I go in the patient's room, I'm going to check their chart and make sure that this blood draw is indicated. I'm also checking which type of tube I need to grab. I'm also going to identify what type of central line the patient has as well. I'm going to check the precautions outside the door. I'm going to knock. I'm going to introduce myself, have the patient identify themselves with 2 patient identifiers like name, date of birth. I'm going to quickly explain the procedure to the patient, do hand hygiene, provide privacy if I already haven't, and I'm going to don clean gloves. I'm going to assess the site. As I'm doing this, once I get my gloves on, I'm going to palpate it a little bit. No redness, swelling, or increased warmth or discharge. I am going to remove the Kuros cap and use an alcohol swab to scrub the hub. This is already clamped, which is good. I'm going to let this air dry. I did that for 10 to 15 seconds. So, I'm going to make sure there's no air in here. Okay, and I'm going to attach this guy, unclamp, aspirate for return, and flush with about 10 milliliters using a pulsatile motion. Okay, and then I'm going to aspirate. And I'm going to discard this guy in a biohazard bag. So, biohazard bag. I'm going to go ahead and aspirate or withdraw the blood that I need for the order.
Grab another gauze and dry one in just one area.
I'm not moving too fast here. Asking the patient if they're feeling okay. Got 10 milliliters here. I'm gonna clamp. Remove this guy. I'm gonna put a new Kuros cap on while I connect the device here. Okay, device is connected. I'm going in at an angle here. These are pretty old, so it might not fill all the way, but I'm gonna go ahead and remove this guy. This would also go in the biohazard bag, and I would place this in a lab bag. Fill that out and send it out to lab, and then I'm going to go ahead and this is clamped. I'm gonna flush again. Get the air removed from here. And clear. Flush. And the pulsatile motion.
Yeah, that's weird.
So again, I'm assessing the site as I'm doing this, and I'm going to assess the site again when I'm done, just to make sure there's no phlebitis or irritation occurring.
All that air. But I capped this, I put a new,
Place a new Kuros cap on. I would discard of that.
what's funny is that
And I'm throwing away all my supplies. I'm making sure that the patient is okay. I'm gonna throw away my supplies, take off my
But that's what it did,
gloves,
I got all the air
make
out
sure
of the
the
system,
patient has their
and then I
call
flushed it, it
light,
worked
if
great.
they're laying down,
And then
beds
as
in a
soon as I
low
tried to
lock
draw again,
position.
yeah,
And I'm gonna go out and document the site itself and the procedure.
Because I switched this out, I think it's this part, because that's the only thing that I can think of unless it's here, 'cause
Yeah.
it's all capped and tight.
That's it.